counterbalance.
I've just had him do a bit of the rotation there. I said, just keep him on the dining room table stuff, so, the chairs, so because I just think the sternum's just contracting a bit, or, but I don't think the slouching's coming from him for, quote, being lazy, that kind of thing, which is where most people would go. Yeah, the balls are fine, huh? Mm-hmm. Just gonna take you a little bit closer.
When was his last surgery?
It was June of 2012.
And his first one when he was born?
First one was he was born. He had one the beginning of June 2012, and he had another one the end of June 2012. His pulmonary valve and aortic valve are cadaver valves.
Girlfriend had a pig's valve.
I was almost gonna get one.
Yeah?
He wanted one. That's very cool.
Did you watch Harry Potter?
Well, you get a tail with that.
Yeah.
He's afraid that when it gets hot, he'll start to smell like bacon.
It's just your brother. So sort of what I did with the cyclist yesterday, I'm just seeing how, again, where his muscles are going to contract with all that, bringing the lengthening of the arm. Oh, okay, thank you. I'm glad you approve. Yeah.
That's good, yeah.
You're welcome, Mike. I can't believe they find that Sophie that much fun.
They all do, just
I know.
delicious, whatever reason. That's a giraffe, Sophie's name. I didn't know. I didn't know. Her baby registered. Yes.
They're laughing all the way to the bank. And I'm going to just do a bit more ball work. But these guys are pretty cool. Every once in a while they're like, can we go to that lady? But then she cancels on me all the time, and so that's just...
I'll tell you, he's better when we come here consistently.
Oh, how was Brazil? Did they go yet? Are they there
They're
now?
back.
Yeah?
They're back.
Was it fun? Yeah? Dad and brother went to Brazil for a wedding. These guys are cool. Any questions with what I'm doing or what you're seeing?
I
Or?
was just gonna ask him, just because the seat's low,
Right.
and that, you might vary that in different situations. Is there a situation that, because I feel like,
The seat's actually low, unfortunately, more so for me. I don't have a place where I can sit up high enough. I might, let's say, on that
Okay,
table,
yes.
but then my feet are off the ground.
yeah.
So, I don't know if I would do this lesson necessarily on someone
Here,
who's
like, so you have
90
to,
or,
that,
or I'd have to organize it, sort of like what I did with the runner and bring her hands down more.
yeah.
So. There, see, I'm just now, you start to feel it, how I'm just starting to get into your chest from here? I'm actually inventing this lesson right now just for you. Well,
It'll be in the books.
just like my boys though, these kids really don't, I mean, I'm not just talking about you, but they are sweet. Once they, like your kids, it's like, Mom, I've been good, why do I have to go to school? Can't I go to Michelle's, They do. She's got an 8-year-old or 9-year-old now that's like, Mom, I got good grades because I do class Thursday morning. Can't I go to school late and go to Michelle's first? Well, he had broken his arm. He was on my table And I went to lift up his arm and I was like, what the heck? I said, he can't even comb his hair. She goes, gosh, he always complains and wants me to do his hair. I thought he was being lazy. I said, no, I can't. Right, it was a double break, ulnar radius,
No, one break.
but the ulnar.
It was a complete though, all the way through the skin.
Yeah.
And you didn't know?
I did know. No,
Yeah.
it was already healed. It had been, I think it had been a year.
But he
didn't-
couldn't, I
he
couldn't
didn't
get
have
his,
any-
Never
It
got
wasn't
made
broken
because of the
anymore.
Protection.
no, but
He
just
just
he lost the
couldn't,
rotation.
Got it.
From being in that cast.
Yeah.
Yeah.
6 weeks and a year later,
You know, and
they told me, no, he'll be
but
fine.
especially more so after
No physical.
Jackson's surgery. I don't mean to just say what kind of that these had, but specifically after open heart surgery, any kind of chest surgery, then you don't want any rotation whatsoever. You know, they have to hug a pillow, they have to do all that. So all these little moves really get lost. I think after even like the last one, having 2 in June, you were bowling by what, September?
About that, yeah.
Yeah.
21 days.
You were bowling 21 days after surgery?
Bowling? Oh, I think you
Yeah.
said home. No.
No.
He was
I
not
think you said
bowling.
bone.
He was golfing.
Oh, I had to talk to this one. She was like, we're going to do the open heart surgery, and then we're getting an RV and rent it from, we're going to go up to Yellowstone. I'm like, I don't know if that's the best idea.
There's a hospital along our way.
And then he ended up, it being a bit more of a stay. There, so see now, the chest is starting to go more where he can walk. She's almost at a spot where she can grab your barrettes in your hair and she's gonna rip your hair out. No, but she sees your barrettes. I don't know if Luciana
Yeah,
knows the
sparkle.
barrettes. See already how much looser. Can you see that more, Luciana, how much more range he can get just by allowing him to feel where he can go with that? So it does look like a stretch, but notice still I'm rotating the elbows. If I kept the,
It's getting to his pelvis.
right, or to his feet.
Yeah.
But see now, even if I rotate the one way, see now he'll come to a fall. But if I rotate just the elbows a little bit, see how the head is much more stable and can stay up.
And I could see the lengthening of the arms also.
So that's an interesting movement that I never think about. So it's such an interesting thing. So you're saying this has to come in a little to come forward.
Well, again, though, if you're
This-
worried
you don't
about your
like that.
chest hurting, let's say, look what he's gonna do to organize those arms out. He's not gonna want to maybe necessarily present over his chest. Now, he's a kid, he's playing basketball and all sorts of stuff. So he's gonna integrate more, but if he was also very only playing on the DS and not playing with these moves, it starts getting very restricted and it shortens all those muscles over your vestibular. So in other words, when you go to lean forward, right, now contract, hold your breath and bring it back, you start pinging, you know, and so it changes the muscle structures, especially for a growing kid. There you go.
And how is his breathing?
And see too, how he starts to come back into position, which is what I'm also teaching you. Well, his breathing is good, but also, you know, I have to give him some credit that he knew ahead of time, but he's doing all this in front of, you know, all these people. So now I'm just working with the ball. But his, just with that rolling. Just so he feels the lengthening coming through another thing, and then also again through me. So that, see there, I would need to work on. You feel that? Versus here. See how?
Yeah.
Does it matter that he's on a bench
Swivel
that
chair?
is?
I actually wanted to swivel.
Yeah.
Yeah. I'm using that to my advantage, but trust me, I can have you sit on it, or especially someone that hasn't been worked on me in a bit, that chair's not going anywhere, even if there is a swivel. Once the energy starts to transfer, then yes, it'll swivel. But if you now look back at the way even Joy's video, you wouldn't see much swivel in her when I first started. That's why when I went like this, the chair should swivel, but see, even he's still going back a little bit, and now he's doing more with the knees. And this way, see how it's a much nicer swivel. But that means probably he's right-handed, let's say. You know, and those kind of things that he's used to that. But that's where I'll take advantage of the swivel chair. But yes, you could do it both ways. Like even that he's sitting on a ball and doing it this way.
And when you say you're looking for lengthening, you mean that kind of
I
lengthening
want
or this kind of
the whole thing. There needs to be a lengthening in the chest that coming over your even your feet. Like lift your feet up and try and do it. See how it ricochets backwards, the counter? My chest goes back versus presenting with the feet over the... But even that, if I'm worried about falling forward or face planting, then I'm only going to go to here and then try and reach or do that or start holding my breath. Whereas I want him to go and go, you know what I mean, and just get something. He's a kid. I don't want him to think about his surgeries and stuff, even though we've just talked about it, but still.
So you might relate it to different sport movements or things that he is doing. I mean,
Right.
you know. to
No,
talk
but
about
that's
that
why I
with the
asked
kid.
him
I mean,
ahead of time.
yeah,
If it's
I know
okay
this
if
is
we brought him in for specifically, so
Yeah.
they learn from him, but
But
you
in
guys
a-
learn from him, but. But he could also told me like, yeah, I'm just not, you know, not ready to go necessarily.
And you're on the sternum now.
I'm just on the sternum, just off the side of it. I never would go like on the sternum. He's the best person to work on because you can just feel, his heart feels like it's on the outside of his chest. He's a really cool beating heart. See, like right there? If you touch someone else there, you would not feel that much of a, you know, the pulsing and all that. I get more so for people that are older, let's say, and they have high blood pressure, you'll feel more of a heartbeat coming through the back because the pressure's increased, you know, they have high blood pressure. Also, the lesson you guys just did with the head, if you feel pulsing up the sides of the veins, that's usually when it's like, you know, is there any hypertension going on? Because sometimes they don't realize it. But if you notice everyone that you're picking up, you're not feeling the thump, thump, thump. Or it could be also, you can catch them having a migraine. And fix you out a little bit because you're starting to slide. You comfortable?
Yep.
Going back to just, again, elongating. Now, even right now, I'm just going to work on his knees just a little bit, meaning I'm just going to rotate in, just to shift the movement over his sit bones. You didn't think I did so much when I worked on somebody, huh?
No, not really.
Yeah, usually we just like talk about.
It makes me go to sleep, so relaxing.
There's enough tables for here to lie down on.
So relaxing.
My mom does that all the time. Can't. Feel the difference? This knee's not moving. Which is funny because it's his right side. So with that, just stay there. I'm just gonna. But it is cool when a kid's just that aware and can compare.
So about 3 months after his surgeries, we came and saw you, but he would roll forward just naturally as a defense mechanism. And I think it was 3 months or maybe it was even 2 months with Michelle working on him, he would allow himself to go, I don't know, I'm not sure the right words, but you could see this versus this because obviously he's protecting us.
Well, not only that, but though the thing
He
is
would be
though,
like this.
he would have grown old with that body though.
Right.
You know, and so his heart and lungs would have hung in the chest cavity. They would have been weaker. I mean, it wouldn't have been as beneficial to him in the long run as well.
But he wouldn't have, you know, instinctively, people don't know that that's wrong because you're defending your,
Well, not only that, but what they took away was his rotation,
Right.
because they didn't want him to rotate the chest. That's why they make you hug things, so you get into the car literally with no rotation.
they
You
even
get-
give you a pillow.
Yeah,
Right.
and then they go, and then it says that, so somebody knows, but to get out of the car, it's literally like this, and you have to get up without,
For how long is that? I mean,
I think that's 6 weeks, right, of the pillow?
Right.
Yeah.
6 weeks. I
Stay.
told our cardiologist what we're doing. He looked at me like, what? And it worked, and I explained it, and you know how good I explained that it's not well at all. And he listened a little bit. Like, no, this made a difference.
Yeah, but, that's the one thing I don't get is you see Jackson walk in like, hi, how are you?
Right.
Nice to meet you versus, and they
Right.
just think he's, and that not, they don't look at like, maybe more of our kids should look like this.
Isn't it interesting that that's the same thing they did 40 years ago, to have a pillow?
Oh, yeah.
What would the difference be with the ball?
They added rotation sooner.
And are you advised to sleep just on your back then with this, sleep on the back,
Now
hugging the
feel
pillow?
it.
and-
Not that, just like when you cough or move.
There you go. See, now he's almost at the point where he can start to think about getting up.
that's nice.
But also too, that's synchronized. So push both feet into the ground. So now see when you want to push, it pushes you back. Don't think about, just think about like creasing paper, not like going through a step, but just push like you're going to start to get up. There you go. See how you can transfer your weight over to the foot.
So you did a little bit on the knee, you just kind of checked that and the pelvis.
Well,
you
because
went to
when I did the
come
one knee,
Yeah.
the left, fine. The right was like,
Yeah.
it was budging, but now it's, but see, now look, see, I'm getting the counter all through the body.
Nice.
But see how he counters everywhere. That's what I like about the ball. So if I didn't have the ball, sorry, just to go. So even though he's got the chair, but see if I do the difference, see he doesn't get the whole 3D effect. And the ball is really nice to do because I can work on all this. Even if he was 1 week post-op, I could do almost something like this. And I wouldn't be affecting his surgery. If anything though, because of what they're told, I'd be scaring the parents. You know what I mean? Because they're like, we're not supposed to do this, but I'm really not doing anything to him. Now what I'm doing here with the ball is I'm actually going to be torquing through the pelvis, but through here, around the arms and the legs. So now again, see how I'm just sort of like I'm opening up a jar of mayonnaise, but I'm countering the knee in. So I'm rotating the knee in. Can you feel it go through the, there. So now he's starting to side sit, see that? But see how gently he's coming with his foot over the system sideways. But can you see how I just did that with the 8-month-old today? But just from his back. Just that, all I was looking for is that contact and that rollover. But look at what I'm doing with the chest. See how he's almost, like not only that, but he's rolling up through and it allows the chest cavity to open here. Do you see that? See how the expansion through the right side? Now if you don't think that's much, again, before I get started, see the difference? See the expansion's not there in the chest and he just collapses through the
He's
knees.
doing this and not this.
Yeah, but now I'm gonna go and do, you can really feel it there, huh? So I'm gonna do a little bit different here. I'm gonna come underneath the ball and just work on the left side a little bit. Now again, that could just be because he's right-handed versus left-handed. He throws a ball with his right hand, not the left. Just because I can't do a move doesn't mean it's surgery-based. That's where you really have to have eyes. Just because someone comes to you because they've had a car accident, it's still, their mom could have dropped them when they were 2. You don't know. Oh, speaking of moms, I forgot my thank you note for your mom.
Oh, she's out of town. Don't worry about it.
You're coming back on Monday or
She
Tuesday.
was so tickled that you were so excited.
Her mom knits me washcloths, and I was down to one, so I got more stash. Or crochets, yeah, knits.
I don't know the difference between crochet or knit. So she does it, this thing. Yeah,
Let's knit.
that's what she
Mom
does.
and I aren't you lucky
That's it.
Mom actually gave birth to you because
Oh,
she's
yeah,
so
crochet.
unmommy. Right, she doesn't bake her sew her.
Are you talking about me?
Yeah.
I don't do that now.
No,
I've
when
tried.
you, yeah, no, I'm saying, aren't you glad you at least got birthed by your mother because she's so unmommy
Which that
like?
was iffy. I mean, that could have gone either way.
You had to. You make such cute kids. Come back to the ball. I'm pushing down into the ball, into the right leg, and lifting up to the left. What's nice too about this chair, it does have a back on it, so I'm not losing him that way. And now I'm pushing the ball down into his left side and bringing it up to the right.
This one's a really good one for the ADD,
Oh,
ADHD.
you guys will be purring after this, right? This is a nice, isn't this nice? Yeah.
Are you all students learning this?
Uh-huh.
Oh, exciting. Now, good.
From all over the
world
world.
needs more of you, that's for sure.
England, Colorado, here, Colorado, Venezuela, Spain,
Oh, very cool.
California.
That sounds country, yeah.
So now I'm going to roll into his lower back. But you see now what his vestibular, how he works with the ball. So the way that the arms stay on the ball when he comes back, he actually, see, and that will create the response of coming, see how the head wants to come up naturally versus me knocking him over. Right? I don't want that kind of, see the momentum? I don't, I'm really conscious when I work that I don't want the head momentum, even though he can handle it. And then I can roll forward.
And when you do that, the elbows also do this.
Oh yeah, no, he's getting a real system, which is great for bigger people. You know, I couldn't do this to a 2-year-old. They're not gonna sit over the ball like this. But also too, how now his hands were much more rigid looking at him. So now if I wanted to, which is again, adult function, I can start working on bringing the wrist out. Remember yesterday I was talking about how you want to go here? But he's now, you know, just about a teenager, so, or are you a teenager? You are 13. I think you'll be like 26 and I'll still say he's like 10 or 11.
Yeah.
I said he was 10, I'm like,
So see how I'm rotating down? And that's where, again, torquing the chest.
Yeah,
So-
that's a big,
Yeah, so,
it's a big stretch.
but again, this is an adult move. This is not something I would do with a 7-year-old because they would be going in. But see how I have to synchronize? See how I get low doing that? I'm not up here going like this.
so with a smaller.
So if
you
he would
go-
wanted to back knuckle me. He laughs.
Should we get a demonstration of that?
Yeah, but then I get to do it back. But see how it's a block and a punch. Yeah, slow-mo. Whoa. But feel the difference? See how I'm not getting the torque in the chest? So I have to slow down. And then I can throw it all together.
Have you always like been able to follow, I just wanted to ask him, follow you? Like, because he seems to be really good at following you. Like, he's not overworking it, he's not bracing. I know you have an established relationship, he trusts you, But did he always do that even younger? Like, where he kind of relaxes?
He's always good at sports and
He's
stuff,
good.
but honestly, just sort of like what you
Sense of-
guys are, if you like me or this is what you want from me, I mean, as far as the whole movement thing, kids are putty with me. They really, I know that I'm some old lady or whatever, and honestly, this poor kid, she and I been talking about everything from food to real estate, you name it, but, yeah, I mean, this is nice, but also because he's also typical. I mean, I'm not dealing with autism or something like that in there where, again, where
Yeah.
you have that kind of feedback, but. So see now how he can tilt more through the pelvis and lifting his arm. But also too, with my touch, that's why I'm very specific. I've never hurt him. I've never put him where he's going to be in a position that he's not successful. I like talking my clients through, like if I did something like this, I would be talking like this to him. You know, now notice, so see, now he's tipping over more. Whereas here, see the difference where he's coming up. So now I have to come back in more a bit, but, I think the real bummer for if some of these kids, and he might be one of them, when they do want to come more still, and the parents are busy or whatever. Because I was working with one girl who needed some help, but I work with the brother, and he's like, he was track, and I lifted his leg up. I was like, I don't know how you're running down the street. Like, his leg was just so heavy. He's like, Dad, I gotta go back to her. I ran so much faster after I saw him. And he's like, but you don't need her, like, you know, kind of thing. Let me bring this down for a second for you to feel it. It feels good, huh? It's like his hands grew.
Yeah. Yeah, feels good.
Now, this too would be a whole lesson. I've actually done this with Enrique, and I might have done with Stuart, where I would have the ball behind, where he could sit on it, and I would do the chest work. And I'm just sinking his spine. That's okay in the sternum, right? It's not a big stretch.
So what are you doing right now?
Right now, I'm just going in, twisting a little bit, but my intent is not so much that I'm touching his abs. I want the lower back to respond and curve. But I'm twisting, as you can see, as if I'm going in, then the leg goes out. I'm not doing same where he would collapse. This is again where I use the chair to my advantage. I'm actually lucky, I do like some of my best work when I'm trying to show off. There we go. But it's allowing the sternum more room to, right there. Can you feel like little points now that are tight in there?
What sports do you play?
Basketball and golf.
And you like golf?
Mhm.
You play with your dad
And my brother.
and your brother? Cool.
He's better than his dad.
Really?
Is that on tape?
Those Walton arms teach me really good.
He's a good long arm, huh?
Yes.
Yeah.
If I can add, one of my best friends she was the first registered nurse at the Mayo Clinic in Minnesota. So she has credentials, and she used to work in the ER, or the recovery room for pediatric heart surgeries. So she saw the before and after for years of students. And she's known him before and after. And she says that he's recovered better than any patient she's ever had. And she attributes it to this.
Have
Well,
her
maybe-
come in.
Well, that
No,
needs to be on your website.
you know what?
And connected to every, yeah.
Yeah, actually I was
Wow.
thinking maybe what I should do is then just do a paper on Jackson. So now the ball's a little bit tighter. Okay, so let's see if I can show you guys this one. So lift your arms up for a second. gonna stick the ball in here. So see, now it's a little bit tighter. So now the roll here is gonna be tighter.
So you have to
So feel the
stretch
difference
more,
now?
or-
So now I'm stretching more his back in a sense than the arms. There we go. Yeah, his wrist just adjusted. Yeah, but it's funny, these stories I don't even know about, so, you know, as bad as her. So now I'm rolling the ball, so he's almost sits up a little bit, but I'm really stretching this arm. But against the
Oh,
stretch of the
that's
sternum.
counterbalance.
So
You're
I'm stretching, I'm pushing the ball into the chest
Mhm.
to see if I can get him to do something more of this, which again would be running, football, all that kind of stuff, and
Especially basketball.
well, basketball, this is a good move too because he's going to be able to pass at a longer distance versus you're going to be here and trying to control the ball. Because the more you have this, the guys are going to attack the ball here, right? But what he can do at that point, he has more real estate to bring the ball in versus an immature player, the ball's here and then they attack and it almost looks like they're fighting on the, but in like a fake. So they can be here like they're about to bounce and then they have all that room to do that and then counter where they're going with the basketball. Had I known about the golf thing, I might even bring him back this week and do a golf lesson on him, but
Do that on me.
I can get someone swing like you wouldn't believe. No, it's not a good position for your legs because I don't want you to fall down. So again, I'm just twisting through the ball. And when I'm twisting, I'm twisting the arm towards me. This would be a punch. This is a hard move to do. But versus that. And I don't want Jackson to be a whip. No, honestly, if you're just like this, hi, I'm Jackson versus, you know, it makes a big difference. But if anybody gives you a hard time, I will kick their ass.
Would you, not that you can do this today or, you know, you should or anything. I'm just looking at the scapulas and the back of the shoulders because you've done a lot here.
Right?
I'm just, and how to check that because
Okay, so
assessment wise.
so just to go, so keep your eyes down the scapulas. So now, what I'm gonna do is I'm touching his knees in a sense, so I'm not, so I'm just now rotating. So I'm stressing the pelvis by sort of holding the knees so the knees can't stretch. But what I'm looking to do right now is to see if he'll go just over the C7. So see how I'm looking for it right here for the chest, the back of the back to rotate. See now, if I don't hold his knees, you see same, and it won't cross midline. See how he's twisting, but the vertebra, everything stays the same. Even though he's twisting, to me that's still not crossing midline. Right? But if I'm here and I'm twisting through the left elbow, you see right there, I'm looking for him to start. And there he is. See how the scapula is now moving on the left side?
And you're going this way? I can't see his whole arm. I guess it could be.
I'm just rotating
Twisting
through the elbow with
that
that
way.
strawberry hold. And there, see? I can almost get him where he can come to sitting from there. That's,
She is going in.
It's like you're moving like a bicycle.
yeah, the counterbalance. But see now, now he can go spin around. But before, remember the legs kind of collapse? But that's your golf, you see that? Okay, now press especially the right foot in. So push it, no, just push it in one, that's your golf. You see the swing, how it comes out? Press, see, this is where you have to work. You're too tight in the wrists.
Right, it's all on the wrist.
But see, bringing the club up now, feel the difference? See how you have weak legs? So now, sorry. Here. So now I'm doing left. Sorry, I'm doing the right elbow. See the difference between the right elbow versus the left? You see the difference? See there, see how he, right there, you can tell with that, he's not a special needs kid because when he's rotating, he's actually coming up and over. But right now, the right arm's kind of doing this, whereas the left, you know what I mean? But see, if he's going to swing a golf club, but when he's coming up, it's a very skeletal sport, and you're using that downward motion versus like hacking grass kind of thing. And an immature player is going to, what do they call that, a chip when they, yeah, versus that whole swing, their back goes out of the way and they counter up that way. Sorry, I do that a bit better when I'm standing, but yeah, feel the difference here?
So what are you doing with your hand?
So here, just to show you this way, I'm just light rotation up, but my objective is back of scapula.
Right.
So that's where it's like I'm playing pool.
Okay.
But if I was here doing that, feel the difference? I really need line of sight.
So that's interesting. But the line of sight makes that a difference.
Well, because also it's my power. If I'm here, for me to direct my movement for him to go here, it's just going to be a weaker touch, less direct. We'll play with that tomorrow. You can feel it. There, now see how he's coming up to sitting? But also too, if I come in here, moving the chair away.
Do you want me to hold the chair?
Yeah, go behind it, just put your feet down to give him a little bit more stability, sorry. And just, so I'm gonna rotate. So now you're not coming up, so if you'll let me do this now, no, that's okay. So I'm gonna rotate down. Now that was actually a little hard. You feel it through the pelvis? A little heavy? Won't take long. So now let's see if I can do it here. So now, when I do it this time now, actually go to sit up. So go. So see how you're not pushing through the feet? Okay? So now again, just a light touch. So come forward. And now push your feet in and go to sit up. So see when you did it first, your tailbone bops up. You feel your butt go up? Okay, just leave that alone. So I'm going to do it this way. So now push through the feet, push through the feet. Nah. See how you're... No abs. Just feel up your spine. There you go. Come back down. Can you guys see the difference? Just that little bit of sitting? No?
You mean when he starts pushing through the feet versus...
But he actually, the line wasn't clear. Sort of like when I was working on you, so again, now I feel the difference. Feel that? I'll come back down. So sort of like when you step on a balloon, you know what I mean, and the air just travels, that buoyancy that just comes up. Thanks, Luciana. So now too, when I come up and I rotate, you see how now the knees are more countering versus him just wanting to go full. See the difference now how he's countering with the foot out. Can you feel that? So press down just a little bit on the left. These kind of coordinations with the foot through the chest and the spine are really important again because that power was taken away for. Now I'm not as worried about it with him now, but after surgery, that's a big move. Okay, so push with the right. Now we just go back to the first. Now we, see how light he's getting? Chair's just moving around.
Wow.
Literally, he feels like he's 3 ounces. No, you feel it, you're not,
Yeah.
it's not, it's really, it's light, it's funny. Now we go back to the scapula, see now the difference. Still, okay, now this, almost crossing midline with the eyes. So here, see, what I'm not getting right now is from twist to twist through the back. Do you feel that? So when I go here, see when I transfer over, right there, it doesn't want to twist. Even a little bit. You like this one, huh? Oh my goodness.
She likes it too.
No, she's doing a typical kid right now. Mom, isn't it dinner time? Oh, she's talking to Madison. We have a fake doll over there. Here, turn around. This child sees the doll there, and she's just squealing like, I want the baby.
As she's saying, that poor kid is all twisted up there.
Nobody's loving her for the baby. I'm going to try it lower. Meaning lower in his arm, sorry. There we go. Again, he's coming over his tailbone better and he's just stretching out there. I'm going to do that on the other side. Just so I'm it's not that I'm restricting, but I'm not moving. There it is. Cool fact is too, when I'm saying I love feeling his heartbeat and stuff, because what am I probably using? Probably 80% of your heart, and you get as high as like what, 147? Don't you get pretty high with your heart efficiency?
I think so.
Yeah. So even though he's gone through all this, his heart is in a sense, right, working better than mine.
Yeah.
There, see how
That's really
that
cool.
wave? Yeah, it is neat.
I'm still processing.
See now, see the
Yeah.
difference now? And that's the acceleration
Yeah.
finally that's changing. So swimming, all of that is right here and very secure area.
Wow. I like this one.
Now I don't mind the momentum. See the difference? How he goes with it. Here. So see? That's it. Now this is just one of those lessons, you don't even see it, or maybe you do, but to go back to the before and after it would be really.
Yeah, he looks totally different. Curious how walking looks.
Now, I'm gonna do one last thing, take the ball away. Now what I wanna do is I'm gonna let your arms fall. This might take a little bit of practice, you might get right, sorry.
Smell, Mom.
Just get heavy, get heavy. Yeah, feel the difference? Notice how I'm not telling you when it's happening. I can do this really well. You
And what
should
do you-
see me jump without using my arms. So. Alrighty, with that, just see how that feels. Walk around. You're gonna feel about 5 inches taller probably.
I do. Oh my
For you.
It's like the chest right here is more open.
Yeah.
Oh,
It's
nice.
so weird. That is right. I do feel a lot taller.
Yeah.
Yeah, expansive.
No, you're gonna have, your eyes are gonna be off a little bit when you shoot and stuff, so, but you'll have more power. You'll get used to it, but you'll have a longer range too at the golf. Well, I mean, just feel it, just golf it out. I know we didn't do that. But now look at it, look where your arms are going. Yeah. Yeah. Now jump. Here you go, see, next goal.
I don't understand that part, but.
You don't need your arms to, most people when they jump,
Yeah.
they contract, but you can actually jump and just let the movement go through your arms.
Oh, how interesting.
So it looks like you've Gumby arms. But a lot of people can't do that. I'm all full of tricks. Cool, thanks.
Thank you.
Very nice.